Hello, everyone. It's February the 3rd on Wednesday. Still, we hate like crazy to lose anyone in West Virginia. We've lost 30 additional West Virginians. It's better. It's terrible beyond belief in lots of ways from the standpoint of we lost 30 more people, but just to tell it like it is, 30 is a heck of a lot better than 83 or 77 or whatever it may be. I was a little concerned that on Monday we had a weekend report, and sometimes we don't get the stuff over the weekend as rapidly as maybe that we normally do through the week, but this is showing encouragement, and but at the same time, 30th death, a 64-year-old male from Harrison County. Our 2031st death, an 82-year-old male from Monongalia County. Our 2032nd death, a 73-year-old male from Marion County. Our 2033rd death is a 76-year-old male from Mingo County. Hold on, let me make sure. Our 2032nd death is a 73-year-old male from Marion County. Our 2033rd death is a 76-year-old male from Mingo County. Our 2034th death is a 93-year-old male from Putnam County. Our 2035th death is a 70-year-old male from Kanawha County. Our 2036th death is a 59-year-old female from Berkeley County. Our 2037th death is a 62-year-old female from Kanawha County. Our 2038th death is a 91-year-old male from Kanawha County. Our 2039th death is a 74-year-old male from Raleigh County. Our 2040th death is an 86-year-old female from Mingo County. Our 2041st death is an 81-year-old male from Mingo County. Our 2042nd death is a 62-year-old male from Raleigh County. Our 2043rd death is a 76-year-old female from McDowell County. Our 2044th death is a 70-year-old male from Kanawha County. Our 2045th death is a 70-year-old male from Preston County. Our 2046th death is a 78-year-old female from Upshur County. Our 2047th death is a 70-year-old male from Berkeley County. Our 2048th death is a 76-year-old female from Jefferson County. Our 2049th death is a 78-year-old male from Raleigh County. Our 2050th death is a 79-year-old female from Preston County. Our 2051st death is a 71-year-old female from Raleigh County. Our 2052nd death is an 80-year-old female from Cabell County. Our 2053rd death is a 71-year-old male from Wood County. Our 2054th death is a 72-year-old male from Monroe County. Our 2055th death is a 93-year-old male from Wood County. Our 2056th death is a 67-year-old female from Upshur County. Our 2057th death is a 77-year-old female from Taylor County. Don't let them just pass away into the dark and be a statistic. They're our wisdom. They're great West Virginians that we've lost, and we've got families and loved ones all over the place that are really hurting and really sad. And let your prayers be heard. Let them be heard. We've also had another tragedy. It was reported to us this morning that a veteran firefighter, Lieutenant Brian Ritchie from the Weirton Fire Department, died from COVID. He was a 13-year veteran of the Weirton Fire Department, and I asked you in every way, we've lost a hero there. Please keep him in your thoughts and prayers, as well as all of his family. Our positivity numbers in the last 24 hours, we only had 535 new cases. Our daily positivity number is at 5.91 in the last 24 hours. Our cumulative number is the same at 5.62. Our active cases are now 19,212. That's the 18th straight day that we've gone down in active cases. Our recovered cases now are at 101,200. I'd like you again to look at the charts. The top line is the recovered cases in the light blue on the top chart, and the bottom line on the top chart, the dark blue, is the active cases. The active, we want to go down, it's turning down, and the recovered, you can see, is climbing, and that's really good. We have 456 people that are hospitalized in West Virginia today and 129 in the ICU units, and we are down. And please put the color-coded map up. We are down to 9 red counties in West Virginia now. We want to keep at it until they all go away. They absolutely go away from that red, terrible-looking color. I remind people that are 65 years of age, I can't tell you enough, you get a sniffle, a headache, whatever it may be, go get tested. Please, please go get tested. If you would happen to test positive, the very second we do that, we'll get your doctors, the antibodies and everything, where we can get the antibodies to you, and we'll stop this terrible killer from taking your life. This week, as far as our vaccine distribution, we're still just knocking it out of the park. Now get this, for last week's allocations, in the vials, we're getting more shots out of the vial than what they tell us are in the vials, And so, but last week, we went up to an administrative rate of 108.1%. It's amazing, of the first round doses, and we're nearly at 70% on second round doses. This week we're already right now on Wednesday at 94.9% of our first doses and 60.6% on our second dose, and that's what we need to keep doing. From the standpoint of, all the different things, now we're at 270,250 total doses that we've put in people's arms. Again, I thank all the people on the community level, all the people at the Guard and our DHHR, all the health community, great, great work. You should be really, really, really proud. Yesterday the CDC announced a report that said nationally, the long-term care facilities, that only 77% of the residents and 37% of the staff were choosing to take the vaccine. Now, I don't know how in the world anything could be more asinine than that. 37% of the staff on a national basis is taking the vaccine. Well, West Virginia, you're doing much better, not as good as it should be, but we're at 81% of our residents and 61% of our staff. We're doing a lot better than the nation. We've done it and done it and done it, but those numbers still need to come up. Our resident numbers should probably be higher than 81%, but God only knows that our staff ought to be better than 61%. But it's still dramatically better than what's going on across our land in the nation. Our vaccine scheduling system, is working, and the pre-registering of people, I tell you over and over, if you're on a wait list, absolutely continue to pre-register. And when there's a vaccine available, you will be notified from our system and as to where, and through the communications, of either text, email, or phone call, as to where your appointment is and when we'll be able to get you the shot. Now get this, since we announced this, and that was Monday a week ago, we have now registered 177,000 people in this. Absolutely, just remember, you're not going to lose your spot by getting pre-registered. This will only facilitate and make things a lot easier and everything. And if you can't pre-register, you don't know how to do it and everything, you can still call, and our people will be answering the phone, and we'll help you through that. On the Saving Our Wisdom clinics this week, we have clinics in all 55 counties, and many of these clinics have been adjusted due to weather. So I want to urge everyone to check our website and their local health department for any changes that have been announced. Residents from any county can go to any one of these vaccination clinics. Let me think here. We do not have enough vaccines to go around and to do everyone. So far, though, we have done 93,498 individuals that are 65 years of age and older on first-round doses, and we've given 25,272 second-round doses. Now, let me say this real quick about the doses. I was on a call yesterday with the Biden administration and all the governors and Jeff Zients, who is the coronavirus czar for our nation and everything. We're going to be given an extra, really it's going to come down to an extra right at a little over 20% additional vaccines that are going to be flowing into West Virginia from the order that we have been getting, the 23,000 and change. We should, with a little adjustment that's going to come, there's going to be 1 million vaccines that are going to be given to pharmacies all across our land, and it's going to be appropriated by population. For all practical purposes, it's going to give West Virginia between 2,500 and additional 3,000 vaccines. And so with all that being said, we ought to be up close to 30,000. It's nowhere close to what we want it to be, but it's better. And we're just going to continue to hope and pray that there's going to be more and more vaccines coming and everything where we can really just get everybody. That's the whole goal. The vaccine info hotline is up there and everything, and you should have that coming up, I hope, in just a second right there. Vaccine reminders, like I've told you over and over. Your number one, defense is your mask. Wear your mask. Please wear your mask. Don't worry that you can get anything from this vaccine like you can, I always say, grow antlers. You can't grow antlers from it, and you can't catch COVID from it. So take your vaccine. Please take your vaccine. There's a scam warning that I want to tell you about. The Better Business Bureau is warning Americans to avoid sharing photos of their COVID-19 vaccination cards. Sharing pictures of your card on social media makes it easy for scammers to create imitation cards that they can sell or to steal or promote your personal information. Don't let them do that. As far as the antibodies, I've told you over and over, we've got antibodies all over the state now and everything. We can get them to you, but we've got to know you're testing positive for those over 65 years of age. It will save your life. You've got to stay after that. I encourage everybody to use our free testing. Our free testing map's up right there. The drive-through pharmacy people are working fantastic. We're down to 57. Man, this is great. 57 outbreaks in our long-term care facilities. And get this, and to our church community, bravo to you. You're down to 4 outbreaks in our churches and in only 3 counties in the state of West Virginia. That's Clay, Nicholas, and Summers. I encourage you all to keep that pew in between you. Absolutely wear your mask. Keep on doing the great work you're doing. Way to go, everybody. It's great stuff. And get this, in corrections, we, instead of having hundreds upon hundreds of inmates and staff, we have 21 inmates in the state of West Virginia that have COVID at this time and have tested positive, and only 24 staff. It's good stuff, good stuff. Our face coverings, you know about your mask and continuing to wear your mask. Absolutely, it works. Wear your mask. As far as giving blood, if you've had the blessing from God above to recover from COVID, we need your blood. We need it really bad. And absolutely, please take advantage of the fact that the Red Cross is waiting for you. and God above has saved your life, go give blood if you can possibly do it. We had a super tragedy just happened in West Virginia. A three-year-old, that the West Virginia State Police responded to a call in Braxton County and found a 3-year-old boy who had died with signs of an extreme physical abuse. There's a stepdad in custody, and it's just really sad. Really, really, really sad. Offer up really tons of prayers to this little boy and his family. Abuse and neglect in West Virginia is just something that is just, it's just hard to fathom how somebody could be mean to a kid. I mean, I just can't imagine it. But if you suspect that a child is being abused or neglected, please report it to the DHHR. Our call number is right there. It's 800-352-6513. It's on screen, and you can prevent a possible next tragic situation that could happen in West Virginia. I want to talk to you just 1 second about our schools. There's so many different reasons we need to be back in school. We need to be back in school because our kids are failing. We need to be back in school for all the needs of our special needs kids. We need to be back in school from the standpoint of trying to have eyes on our kids to see if we can prevent the next tragedy of abuse or a bad situation that may happen with our kids. We need to have eyes on them. We need to be back in school from the standpoint of the economics and daycare and on and on and on, do we not? Without any question, we need to be back in school. We have tried with all in us to make our schools as safe as we can possibly make them. We can't guarantee perfectness anywhere. There's no way that we can do that. Only God above can do that, and we can't do that. But we're told by the science and the medical communities over and over and over that our schools are safe. We have gone another step forward in vaccinating all of our teachers and service personnel that wanted to take a shot that were of age 50 or greater, with the commitment that as soon as we get an ample supply of vaccines, we'll double back through and get all the people that are under 50. I don't know what else we can do. And from the Biden administration, this just came out and says, CDC, schools can reopen without teacher shots. Well, you see, we have gone so overboard in trying to make it really safe and really good. I recognize with all in me the anxiety that our teachers and our service personnel, that I believe with all in me are good people that are doing good work, and we need them. We deemed them all as essential, did we not? And we've now given them all over 50 their shots, or their first round shot, and we're doubling back right now in the second round. But I guess this is a Biden administration person. I don't know exactly their title, but says, as some teachers' unions balk at resuming in-person instruction before teachers are inoculated, Dr. Rochelle Walensky says vaccination of teachers is not a prerequisite for safe reopening of our schools. And Rochelle Walensky, I don't know exactly her title. She's with the Biden administration, and I don't know her personally, but basically, I'm sorry. She is the director of the CDC, so forgive me for that. But anyway, the net of the whole thing is just one thing and one thing alone, and that is just this. To the very best of our abilities here as your governor And as the people that are working here through DHHR and National Guard and our coronavirus czar and all of our great, great people that in our medical community and everything, we're trying to make it just as safe as we can possibly make it. There is no guarantees. There's no guarantees. We're trying with all in us to do all we can to make things as good as we possibly can and minimize the damage. So nevertheless, that's all I've got right now. Thank you so much, and keep up the good work, West Virginia. We're getting there. We're getting there.
All right, thank you, Governor. Let's now go to Dr. Clay Marsh, our coronavirus czar.
Well, good afternoon. It's always a pleasure to be with you. West Virginia's had a lot of recognition about how we are handling the coronavirus pandemic. And the governor always gives a lot of love to everybody else. And I want to make sure that for all of us in West Virginia that we appreciate the great job the governor's doing. He's sitting in a very difficult position, and I think he's done an extraordinary job in leading the state. And I, for one, am very proud to be a citizen of this state. As we look at the immediate future, what we see is that we are seeing a reduction in hospitalizations, and over the month of January, we've seen a reduction in deaths. And I think that's very notable, and there's probably a number of reasons for that. But specifically, I think our vaccination strategy and the fact that we've been able to vaccinate so aggressively and target the most vulnerable of us as West Virginians, our nursing home residents, our assisted living residents, our folks over 65, and particularly as we've talked about, the rate of death goes up so extraordinarily as we go from 65 to 75 to 85 and beyond, that it's really quite extraordinary. And so targeting this population, I think, has been a very central and key reason why we've seen a reduction in hospitalization and in deaths over the month of January. And I just want to reinforce the great credit that goes to our joint interagency task force that's led by retired General Hoyer and retired Colonel Peel and all the people there, and certainly our DHHR group. We have really such a wonderful leadership team. Lastly, I want to comment on where we are with the vaccines. We anticipate the Johnson & Johnson vaccine to be going through FDA emergency use authorization in the next 2 weeks or so. And one thing that we all have to recognize about these vaccines, the Pfizer and Moderna vaccines are scheduled on a 2-shot schedule. Pfizer 21 days apart, Moderna 28 days apart. Johnson & Johnson is 1 dose. And the thing that I think is really important, I talked a little bit about the Johnson & Johnson vaccine before. What's really important, when you look at people being protected from severe disease or hospitalizations or death, Johnson & Johnson, across all of the people in the trial, which was worldwide, protected people by about 85% from severe disease and hospitalizations and dying. Nobody died in that study for 28 days after the first vaccine. When we look at the Moderna vaccine, 14 days after the first vaccine, and over 80% reduction in severe complications and hospitalizations. And from Israel, we're finding out that the Pfizer vaccine, after about 18 days, reduces over 60-year-old hospitalizations by about 60%. So these vaccines are all so effective, even as we're completing that 2 doses of the Pfizer and Moderna and the 1 dose of Johnson & Johnson in reducing hospitalization, severe complications, severe illness, and death, which is why we are so committed to trying to get more vaccine for West Virginia and trying to get those vaccines in the arms of people. The governor will tell us every vaccine in the arm may be a life saved. And that is actually true. And we're starting to see the data nationally, internationally, and we're also seeing it in West Virginia. So thank you so much.
All right, thank you, Dr. Marsh. Next to Dr. Ayn Amjad, our State Health Officer.
Good afternoon. I do want to mention our website, vaccinate.wv.gov, for any more information. And our vaccine clinics did start across the state. And I do want to remind everyone about the online registration system if you haven't visited that yet. The governor did mention about the great online amount of people that did register, but also to remind everyone that this is a pre-registration system. It does not guarantee the availability that is dependent upon the amount of vaccines that the state does receive. We do want to remind everyone to please be patient with us. We do want to make sure everyone does get the vaccine, but that is a pre-registration system. But if you can't do it online, we still get the phone calls as well. But everything is available online if you want to visit that as well. And as the governor mentioned, if you do see anyone that is having any abuse in their homes, to please call the number. I wrote it down, but it's 1-800-352-6513. Thank you.
All right, thank you, Dr. Amjad. Retired Major General Jim Hoyer, Director of the Joint Interagency Task Force, is also joining us today and is available for questions. Secretary Bill Crouch had a prior engagement today and will join us again on Monday. We'll now go to questions from members of the media. The first today from Kenny Bass with WCHS and Fox 11.
Hi, thanks for taking my question. I actually have a couple, and I don't know if you guys can address them both, but one is to General Hoyer about problems with vaccine distribution and possibilities that there's some skullduggery that's taken place allegedly that's resulted in either arrests or investigations. So what light can you shed on that? And then Dr. Marsh, following your appearance at the subcommittee meeting yesterday, which I listened to, it struck me how politically charged that was. What was your takeaway from that? And does that do any good? Because it feels like that's a lot of time spent with each party criticizing the other and shoring up their own stance. So what positives can you take away from your experience yesterday? If you guys could address those two things, I'd appreciate it. Thank you.
Okay, General, go.
Yes, sir, Governor. So, Kenny, we have assigned to the Joint Interagency Task Force a state trooper, and we also have personnel from the Department of Health and Human Resources Inspector General's office, and they look at anything that comes to us. I believe we have 2 cases right now that are being reviewed, and I couldn't comment on the status of those because there's an ongoing review of those cases. But we do have a mechanism in place. The governor tasked us to make sure that we were looking at those challenges that are reported to us, and we'll be aggressive in reviewing those and finding out any necessary information.
Please, you got the second part.
Okay, well, thank you, Kenny. I'm so proud to be able to represent West Virginia. And as the governor tells us all the time, the key is that we are a state that is together. We're pulling the rope in the same direction today. So while certainly there may have been some partisanship related to some of the preamble questions and statements, I really do feel like that West Virginia may well become the beacon to start to light the way forward and start to focus on the greatness of America, not the separation of America, as part of our armamentarium moving forward to solve this COVID pandemic and make the United States and certainly West Virginia as a lead to help people live better lives. So thank you.
All right, thank you.
Just 1 second. I want to do this too. I want to again thank all the different people, whether it be Dr. Marsh or Dr. General Hoyer, all the people that turn this wheel in lots and lots of ways. Dr. Amjad, Secretary Crouch, all the people out in the field, they're doing amazing work. But I want to tell you just this, I'll be a lot more blunt. My feelings about what's going on in Washington, D.C. are not good. It is a crying, pitiful shame that people opt out. And just ask yourself, and this is all you've got to ask yourself if really and truly in your heart you could possibly feel like when people are dying and people need you so badly, is Washington just up there playing politics and absolutely with people's lives on the line? Well, of course they are. And it's just terrible. And what's the price tag? What's the price tag of what they're doing? Every one of them has got, 8 clerks that are working right with them and doing all the different things that they're doing. I mean, Washington is just a hub of who can get who and a gotcha thing. It's not what it needs to be. And we have absolutely regressed in this nation, and it is a crying shame. I really, really, really appreciate Dr. Marsh going on. And can you just imagine, I mean, we're getting call after call from the national media all over the place and everything. It'd be easy from my standpoint to, go grouse hunting or something like that. But I try to do every single one that call. And the reason I do it, and it's a pain a lot of times, and the reason I do it is just one thing, and that is to fly our flag, to let the nation just see how good West Virginia truly is. And as the nation sees how good we truly are, there'll be more and more goodness happen to West Virginia. And maybe, just maybe some of the good sense that we have in this beautiful state will wear off on these people that are absolutely, in my opinion, just not doing right by all of us. And so...
Stephen Adams with Ogden Newspapers.
Yeah, this is Steve Adams for Ogden Newspapers, and this is concerning senior centers. The executive director of the Wood County Senior Center told one of our reporters that they are supposed to be getting more funding from the state, but haven't seen anything yet. While that's going on, they had to relax their restrictions on free meals to basically anyone. So they're doing instead of having it based on need, they're doing up to about 30,000 meals, more than what they usually do. And at the same time, their staff is reduced, so they're completely overwhelmed. Second question, they also want to know in regards to homebound seniors, what's the process for getting homebound seniors their shots? So I know that's 2 questions, but that's one of the things that the Senior Center in Wood County wanted me to ask about. Thank you.
Stephen, Secretary Crouch isn't here today, but I can tell you from our standpoint, I don't think that we've gotten any information, on what you referred to that's going on there. But we'll reach out to that director and seek information there. But Dr. Amjad, if you could answer the other part of the question, please.
Sure, Steve. I'll find out about the information from you, Steve, to see about the meals that are being reduced. And regarding the homebound, I'll have to ask General Hoyer about that, because I know he's working on getting information on vaccines to the homebound seniors.
Yeah, Stephen, as mentioned earlier, I believe in the week, we have an effort going on with VOAD, the Benedum Foundation, Senior Services, and a couple of other agencies and organizations to identify, and in the new Everbridge system, as you register, we will be able to look and identify those who are homebound. We're also working with the various disability councils as well to make sure that we identify those populations. So as vaccines become available, we can get to them. We also have a plan to use health sciences students from across our universities and colleges, as well as National Guard personnel, to help augment our local health departments and federally qualified clinics to provide that support.
Back to me just saying, Dr. Amjad, I apologize. I messed that up. I should have gone to General Hoyer with the ending of that, but you got the meals stuff, so I'm sorry, I messed that up.
All right, thank you, Stephen. Next, we'll go to Brad McElhenney with West Virginia Metro News.
Hi, Governor. Hi, everyone. Governor, you may remember Mitch Carmichael. He was the president of the state Senate. The state online phone directory, as of this week, lists him as an employee of the State Department of Commerce. Is Mr. Carmichael now on your economic team? Thank you.
Brad, I don't know that we have officially announced that yet, but what we're doing is we're trying to break out and be more efficient on our economic development, and we feel like that Mitch can be a terrific asset there, and he will become our economic development director. And we feel like with his personality and his stuck on personality and everything, that he can really bring some real oomph to us there. And at the end of the day, what we want to do in West Virginia is lots and lots and lots of good things, but we need to constantly work on economic development, expanding tourism, and expanding diversification. And we've got some announcements on tourism, that are going to come real soon. And I was really going to do that in my State of the State, but that may very well be out and everything. And if it is, that's where we're moving.
All right, thanks, Brad. Next to John Mark Shaver with WV News.
Hey, everybody. Looking at the pharmacies that will be getting these extra doses in, what's the relationship between the state and these pharmacies? Will they be pulling from the state's registration list, and will you guys be getting information from them about who's been vaccinated?
Okay, General Hoyer and Dr. Amjad, this is you guys.
Yes, Governor. So that is still a work in progress. We don't have all the details from the federal level on that. We have been told that it does not count against our overall allocation that the governor pointed out earlier, but more to follow as we get more information from the federal government. I would tell you, and I think the governor would reinforce that we believe we in West Virginia have developed a good, solid delivery mechanism, and we want the support from the federal government to, as best as possible, fall into that mechanism so that we can be efficient and effective in getting to our citizens quickly.
Back to me, just saying, I can follow up on this and just say this: as far as those doses cutting into the doses that are our amount that we've been receiving, or the increased amount that we're going to receive, they do not. We were told that yesterday, or I was told that on the governor's call yesterday. They will not. This is an additional bracketing of doses that's going to go to these pharmacies, and in addition to the state's amounts, plus the increase of the amounts that are going to the state.
All right, thank you, John. Next to David Beard with the Dominion Post.
That maybe Pfizer and Moderna could just take the recipe and hand it out, and license all the hundreds of other pharmaceutical factories across the world, like the one here in Morgantown, to just make it for them. But what I've been able to read, what little I've been able to read, is that it's really not that simple, that there's maybe a tiny half a handful of companies in the world that actually are capable of making these vaccines. And maybe someone could elaborate on that and help us understand why there's not enough. Thanks.
Well, David, that's way, way above my pay grade. Dr. Marsh, maybe you can do that one. I can't possibly do that one.
Okay, Governor, I'll take a shot at it. So thank you, David. As you rightly point out, there are very, very strict manufacturing regulations related to any kind of pharmaceuticals, but particularly vaccines. And early in the process, as Moderna, which is a really small company was really a startup from the Harvard Medical School in Cambridge, Massachusetts, and for the Pfizer vaccine, this was a small biotech company in Germany that they absorbed. The AstraZeneca, which is not currently approved here in the United States, was the University of Oxford's vaccine, and Johnson & Johnson, they have their own pharmaceutical company, Janssen Pharmaceuticals, inside of J&J. So these vaccines do require critical sort of regulatory environments. They require raw materials, and early in the manufacturing, there was a challenge getting those, which is, I think, why the Defense Production Act has been activated. And one promising note, because all these manufacturers are trying to really ramp up, and the goal and the demand for these vaccines is worldwide. So there's so much demand. But for instance, there's a partnership, I think, in France between Pfizer and Sanofi, and Sanofi is producing vials of the vaccine in collaboration. I'm sure they're getting paid, but this is a way that we can start to partner these very highly specialized pharmaceutical companies who are all able to do this. And as you say, it's a small group of these companies that can do that. And I think you'll see the manufacturing go up, and particularly over the next, month to 2 or 3 months, I think you're going to see a real ramp up. And as we add the Johnson & Johnson vaccine, at least anticipate that, and the AstraZeneca vaccine is being also used around the world, the hope is we're going to fill in that shortage here very quickly.
All right, thank you, David. Next to Paul Mullen with WCBC.
Good afternoon, Governor. Good afternoon, panel. With Johnson & Johnson about to come online, when you do have a clinic, will people coming to the clinic have their choice of what vaccine they're going to get? General Hoyer question.
Okay, General.
Yes, Governor. So, Paul, no, I don't think that would be the way we will do it. We're going to look and continue to look at the data, and Clay can help me out with this one. Because of the value of the Johnson & Johnson vaccine related to the fact that it prevents death and it drastically reduces hospitalization, we'll continue to look with our medical experts at how we might focus that in a particular age category. But it is a very important tool in our arsenal to get people vaccinated going forward. Clay?
Well, I think that's exactly right. The only thing that I might add is the other benefits of the Johnson & Johnson product are it's much easier to store and to move because it's much more stable than the Pfizer vaccine and even the Moderna vaccine. And it is a single shot versus the current application of Pfizer and Moderna, which are 2 shots. And I think that that's an advantage as we can immunize people one time and that be really all they need for that series. So we will continue to evaluate and understand where best to position the different vaccines. But as Jim Hoyer just said, having more vaccine and what the governor has asked for our White House officials that we've talked about earlier is we just need more vaccine, because the more vaccines we put in arms, even a single shot of any of the vaccines is an important move forward to save lives and protect that hospital capacity. But also, as these variant viral forms are starting to move in the United States, it also appears to be very important to give that 2-week period at least after the first dose of the vaccine before we have the onslaught of these variant forms of the virus, so that we give people some immunity going forward. So we will be very aggressive about using all vaccines. Thank you.
Back to me just 1 second. And I was told this, Clay, I was told this from General Hoyer. Now, I didn't come up with this on my own and everything, but General Hoyer told me this and everything, because I know y'all are together a lot, but he just whispered it to me. He said, if Clay hadn't said that Pfizer would do 95% and Moderna do 95%, and then said Johnson & Johnson was do 65%, we wouldn't have to be going through these questions. And I'm only teasing you. I'm only teasing. Really and truly, everybody needs to really pay really close attention to just this. And here's the bottom line. From the standpoint of our FDA and stuff like that, they're not going to put a vaccine out to all of us. There's no way that they're going to put a vaccine out that's subpar. That's all there is to it. When we get our vaccines that come into us, we're not going to have subpar vaccines and tell you, well, we really don't have the good ones, but we've got a subpar one. It's not going to be that at all. Really and truly, the Johnson & Johnson vaccine has many, many, many wonderful characteristics and everything. But the number one characteristic is 100%, that when it came out, that as far as what we know today, as far as anyone dying, and so with all that being said, you don't have to be concerned about, one being better than the other one and everything, because as we go forward, with how we progress throughout this entire pandemic and everything, there'll be ebbs and flows. As sure as I know my name, there'll be somebody come out and say, well, I just heard, I think this morning, to where it may be that now with Pfizer, you have to have a third dose and everything after 6 months. There's going to be that kind of stuff that comes out. But Clay, I wouldn't have mentioned it because General Hoyer mentioned it to me. And so I just thought, it'd be better to just kind of tell everybody, who started all this mess and everything. Nevertheless, I'm just teasing you.
All right, thank you, Paul. Next to Zach Shrivers with WTAP.
Hey, Governor. Hey, everybody. Hey, Paul actually asked my question, so thanks, Paul, for bringing me up for another question. We've had several phone scams up here in our area lately, and I was kind of wondering, as people get signed up and registered for their vaccine.
Please.
That's a great question, and I don't have the answer to that as to how it comes up on your caller ID right now. But what we will do is we have a joint information center within our joint interagency task force, and we'll make sure we get you some information updated on that and allow it to get out through other media outlets to make sure that we're avoiding that problem for our citizens. But thanks for the question.
All right, thank you, Zach. Next to Junaid Dill with the AP.
Hi there, thanks. The federal government announced a new plan to send 1 million doses directly to pharmacies nationwide. Walgreens said it's participating in West Virginia. I'm wondering, are there smaller West Virginia pharmacies or chains that are getting involved in this? And how much of an impact will this have in West Virginia, getting pharmacies direct doses? Thank you.
I mean, Dr. Marsh, come on, can you answer that? I mean, I think what I know is what I was told on the line yesterday, and what I was told is they are reaching out to the smaller pharmacies to contact them or contact, I guess, us, and then we contact them. But I think it's going through larger chains, but at the same time, Dr. Marsh, maybe you could add a little bit or whatever this.
Yeah, thank you, Governor. I think that this plan is to push through the pharmacies so the pharmacies can be more active in the distribution and vaccination. My understanding is as well, it would go through larger pharmacy chains to perhaps smaller pharmacies. But I would say that I do not absolutely know that to be true. And I might tag Jim Hoyer on this question, much as he whispered in the governor's ear on the other question. So Jim, do you have any other insight?
The information, as the governor pointed out, he received a certain amount of information, but what we're getting is this rollout is a work in progress, and the governor has made clear, as well as his leadership team, that just like with our nursing home and assisted living facilities, we want, if we're going to do this nationally, we want it opened up, and we would like to have it coordinated through our state efforts so that we can do the best by our citizens.
All right, thank you, Junaid. Governor, I'll turn it back to you.
Well, again, I want to thank everybody, and I want everyone to know just this. As tough as this is, and as great as our team is, we work great together, and we tease each other a little bit, and maybe that takes a little edge off of the stress and all the level of anxiety that you got to go through in this. But I just thank them all. They've been unbelievable. I mean, our coronavirus star and our general and our secretary and Dr. Amjad and everybody all through the health systems and everything. So many people really stepped up, and whether they be their first responders and on and on and on. But it is amazing what West Virginians have done. But with all that, all I'd like to add is just a little bit of an update on the stimulus package and all that's going on. If you've seen me on that national broadcast, I've been the first to step up and say, really and truly, our nation, in my opinion, needs to go big or not go at all. And the reason I say that is because we got too many people that are still out there that are really hurting, and that's going to help in every way to right side our economies, help our states, absolutely more than anything, help our people. And so, so many people have been absolutely just disrupted or a cannonball right to their stomach, and they had nothing to do with this. Nothing. It just came out of no man's land, and there they are sitting at home without employment, or so many of our businesses are suffering beyond belief and everything, and they have gone and borrowed against their savings and everything to just some way keep the doors open, and many, many, many have closed. And so from my standpoint, I've never seen a situation that is a problem of this magnitude that you can cut your way out of the problem. In this situation, you've got to step up and step up big in order to get out of this spin cycle and get everything moving and moving in the right manner economically, while you try to right the boat as far as you can from a health and safety standpoint. The other thing I'd like to report is yesterday, the Biden administration went back and made retroactive to January of 2020 the FEMA, I guess, requirement of the 25%, that we would have to pay, that they're going to go back to January of 2020 and reimburse that money in whole. And so that's a big lick to West Virginia as well. So with all that being said, again, I thank everyone, and I appreciate all the good work we're doing. You can see the numbers are getting better, and we want to stay optimistic and look for a better day. We're going to get through this, West Virginia. We're showing the world just how good you really are. Thank you so much.